everyone, and welcome to our final day of health content here at Dallas Weekly for our special health edition. Today, we have this topic of diabetes. And with us, we have Dr. Gunasekaran, the lead physician in outpatient diabetes clinic at Parkland Health and Hospital System and assistant professor of internal medicine at UT Southwestern Medical Center. We have Sharon Cox, registered dietitian at Parkland Health and Hospital System, and Ellen Zignego Smith, registered nurse and diabetes care and education specialist. Thank you all for joining us. Let's sort of take it all the way back and let's say, what is diabetes? And anybody can answer that.
Diabetes is when the pancreas, which is an organ that's right next to the stomach, doesn't produce enough insulin. So insulin is essential for life. Your body can't use any of the energy it has unless insulin's around. And when people develop diabetes, that pancreas, I like to say, gets a little bit lazy and it doesn't make as much insulin as it should. So your blood sugars start to go up. And so you have to start taking medications to either help your body produce more insulin, or you have to take insulin injections because you just don't make enough.
And how prevalent is diabetes in the United States?
Approximately 10% of the US population has diabetes that we know of. The assumption is another 10% has prediabetes or diabetes that hasn't been identified, because diabetes tends to be a silent disease. You tend not to feel any different until things get kind of bad.
And so that's almost like 20% of the population, like a fifth of the population.
That is correct.
And you said the symptoms aren't very noticeable, but what are they?
Some of the things that you may notice is peeing a lot, being thirsty a lot, especially you hear a lot of people saying that they get up at night a lot to pee when they usually didn't before. They may be losing weight and they're not really sure why. A lot of dry mouth as well too. When things get really bad, you may also just feel generally tired, dizzy because you're just losing so much water all the time. And that's usually when people end up either at the hospital or their doctor's office to say, hey, I don't feel good. What's going on?
Yeah, and talking to some of the other doctors at Parkland, they always seem to say that the time that people come in is about the time that it is horrible. Is there any kind of screenings that that people can do to make sure that they're not having diabetes?
Yeah, so it's recommended now. The newest U.S. Preventative Task Force guidelines this year suggested starting to screen people at the age of 35 if they have any sort of risk factors. And I'll be honest, it's pretty hard to find someone who doesn't have a risk factor, meaning being of a certain ethnicity, being of a certain weight, having a family history or other medical conditions. So you should be going to see your doctor for your regular checkup. And as part of that, they are now screening more for diabetes, like you mentioned, to catch it before you even have any symptoms. We can turn that curve a little bit so you don't end up in trouble.
Yeah, and let's keep on that. I'd like to kick it over to Ms. Smith. What are some of these risk factors, and what do you see in your professionals as families or individuals coming in suffer from?
There are a lot of risk factors, and that really is a key to informing both our patients and their families. So some of the risk factors are a family history. And with the individuals that I deal with, there's quite often a huge family history. So that's a big one. Being overweight or being obese. Overweight's described as body mass index over 25. Obese is described as body mass index over 30. And as Dr. Gunasekaran said, certain ethnic groups, African American, Native American, Asian, Hispanic, all are at a higher risk for having diabetes. Diabetes as we get older. As we get older, we have a higher risk. Diabetes in pregnancy. If someone develops what we call gestational diabetes or diabetes during pregnancy, they are at a higher risk for later developing diabetes. Alcoholism, being on steroids for an extended period of time, all these are risk factors. So when someone has these factors, it's really important that they know you may develop diabetes.
Okay, and yeah, those risk factors, you mentioned the different ethnic groups, and let's speak about African Americans for a second. It's been commonly known amongst our community that diabetes is a thing, but we seem to have this sort of diabetes 2 and some other things. Can you explain a little bit about what diabetes 2 is?
So there are different forms of diabetes: type 1 diabetes, type 2 diabetes. So type 2 diabetes, really about 95% of the population has type 2 diabetes, where individuals a lot of times are overweight or obese. The symptoms develop much more slowly. They're not as rapid. Type 1 individuals, we used to see in the young, we are seeing now later in age, but the symptoms are much more rapid. There is weight loss, extreme thirst, all the symptoms that Dr. Gunasekaran was talking about, but they develop much more rapidly. Type 2, it can be very, very slow, even over a period of years before someone really realizes they have diabetes. And often, as she said, it's something else that brings them into the office. Oftentimes with the individuals that I see, it is the blurred vision. You know, they go to the eye doctor. Do I need a new pair of glasses? When actually it's their blood sugars are higher. So type 2 is much more gradual, and it affects a larger portion of the population.
Okay. Ms. Cox, staying on the community of African Americans, it seems to be that the type of historical foods we've eaten has led to this kind of spike in our having diabetes. Can you speak a little about the dietary issues that cause diabetes and how African Americans are maybe exacerbating their own healthcare?
Okay. I guess there's no food that really causes diabetes. As you've heard earlier, it is family history, the genetics. The food choices that we do make are back from what we call soul food, but that food is nutrient dense, like yams or healthy foods, is how we prepare it and how much we eat. So if you have a Sunday dinner, you have greens and yams, mac and cheese, and some type of meat or, fish, that's fine. Again, the portions of your carbohydrates intake, which would be starchy foods, fruits, milk, those also would affect your blood sugars. We do tend to have a higher intake of fried fatty foods, but I think we're gradually changing that to more baked or grilled, skinless chicken, which my patients don't care for too much. But again, we're learning to make some modifications in our food prep. If we plan our meals and we reduce the amount of sugar, the amount of salt and saturated fat that we take in, and eat plenty or half a plate of green vegetables at most of our meals, we will do fine. But everyone knows about soul food, but again, we don't eat that type of food every day now. That's reserved more or less for holidays, birthdays, special occasions.
And what are some foods that are beneficial?
Your green, any foods that grow on the ground, any of your leafy green vegetables would be great. But I mean, that would include corn, and that would be a carb, but more leafy vegetables would be really ideal. If we had a half a plate of vegetables, greens, broccoli, spinach for lunch and dinner, that would help every day, and not just on, not just on the weekend for Sunday dinner. And then fruits are good, whole grain products are helpful, and beans, peas are foods high in fiber. That also fills us up, prevents constipation, but also helps to lower your cholesterol level, which again, heart disease is one of those risk factors that persons with diabetes would have. And you need your protein. So your lean protein serving would be skinless chicken, fish, turkey, about the size of your palm, one piece at a meal. And then the rest of your plate, you could eat your starchy food you like. So potatoes, corn, rice are okay in the right portions.
So it seems like we have all these things, peas, yams, carrots, all these good things. It's just the way we're preparing them. So I guess we could sort of talk about like what some conditions that we could use to start preparing food a little differently in our community, because it seems as though like we eat all those things. It's just don't fry them, like.
And if you did fry it, it would be maybe use canola peanut oil instead of vegetable oil. and take the skin off, put your seasoning on the meat itself or the chicken and batter it, you know. And I mean, you can oven fry it, put it in the oven and bake it, and it will be crispy. But it's just, again, about how much and how often we would eat some of those foods.
Okay. Dr. Gunasekaran, how is diabetes actually diagnosed in a patient?
Usually it's done by a blood test. We usually draw blood, run it in the lab to see what the blood sugar average is or what the blood sugar is right now.
And is there a cure for diabetes?
Man, I wish there was a cure for diabetes. You know, Ellen mentioned type 1 diabetes versus type 2 diabetes. So in type 1 diabetes, there's some sort of injury that occurs where the body's immune system doesn't recognize the pancreas and it kills it off, and it no longer produces insulin. But you don't have that problem that you have in type 2 diabetes where you're not making enough insulin and your body doesn't use it very efficiently. So for people with type 1 diabetes, sometimes at some point in their disease, sometimes they can get a pancreas transplant, which essentially cures them of their diabetes for as long as that pancreas transplant lasts. Unfortunately, the immune system that got revved up and killed the first pancreas will likely kill the next one as well, but it buys you some amount of time. In type 2 diabetes, you can't really transplant the pancreas and fix the problem, because the problem is the pancreas can only make so much insulin, and the body doesn't efficiently use what it makes anyway. So it's not like you're ever going to make up for that. So it's really just a chronic disease that we manage rather than something that we can cure.
So what are the treatments? Is it just insulin?
No, there are oral medications, there's insulin, there are non-insulin injectables. If you watch any sort of TV, you can see all these happy people in commercials taking these different medications saying, hey, you know, my diabetes is better controlled. So in the past, I would say 10 to 15 years, there's been an explosion of different kinds of medications that aren't insulin, that are really helping people both control their diabetes, have better heart outcomes, and maybe even lose some weight.
Okay. And since we're living in the age of COVID, are people with diabetes more or less likely to contract COVID out here?
So studies have started looking at that, and they don't think there's any difference in the population between contracting COVID, or there's something specific about people with diabetes that are getting COVID. What we're finding is that people who contract COVID, the ones that end up in the hospital, tend to have diabetes. The people who die from COVID also tend to have diabetes. So if we're talking about Dallas County, which is where we live, approximately 47 to 48% of all of the hospitalizations since the COVID pandemic started, people had diabetes. And of the people who died, the number one chronic disease that they had was diabetes. And so looking a little bit closer at that, we have found that if your diabetes is better controlled, when you contract COVID, you tend to do better. So it's important during this time to continue to access healthcare to take care of your diabetes. But that's one of the main reasons why I've pushed a lot of people that I see to get the vaccine, because I see people pretty much only with diabetes. And I don't want them to be one of those statistics where they at least end up in the hospital or even die from it just because they have diabetes.
Okay, Ms. Smith, what is Parkland doing to help manage? It seems like management is the biggest factor in helping people with diabetes. What is Parkland doing to help patients manage their diabetes?
So Parkland approaches it in a lot of different ways. We have nurses meeting with individuals one-on-one. We have dietitians such as Sharon meeting one-on-one to give counseling on meal planning. We have pharmacists who meet individually to discuss all the different options. You know, as Dr. Gunasekaran said, there's so many different medications. So oftentimes our pharmacists will meet individually, but we also have classes. And with this age of COVID, we have gone virtual with a lot of our classes. So some classes are still offered in person. Some classes are offered virtually, but those classes involve understanding diabetes, problem solving, healthy meal planning, exercise. They involve monitoring or checking your blood sugar, taking medications, with the disease and also reducing risks of diabetes. So we have a lot of different topics, and we really try to cater it to the individuals we're seeing. You know, I see some people who can't read or write. So it's a matter of showing visual models. It's a matter of a sheet that only has pictures on it to keep track of their sugars. But the understanding, it's a lot to take in. It's actually quite overwhelming, Patrick. When someone comes in our office and they've just been diagnosed, it's a lot to take in. So I think it's meeting someone where they're at. It's really concerning you. Where are you at and concern right now, and trying to address that concern with them.
And I know it might sound like an easy question, but why is it so important to manage your diabetes?
I don't think it's an easy question. That's it. That's the key. And you know, the answer may sound simple. Yeah, take your medication, follow a meal plan, do some type of exercise. When I say exercise, people think, oh, join a gym, but it's not. It's walking. It may be sitting in a chair. It may be standing in a pool and walking in a pool, even if you don't know how to swim. But it's so, so important because the risks of diabetes are huge. They affect every part of our body. If the blood sugars are high over an extended period of time, people can be at a greater risk for stroke. We have an increased incidence of dementia among people with diabetes. We have, you know, the number one cause of blindness is from individuals with diabetes and blood sugars not being controlled. It affects our hands and our legs. You know, you hear numerous stories about amputations, and that's with sugars being high over a long period of time. The nerves can affect our stomach. They can affect our sexual function. They can affect our heart. People with diabetes are 2 to 4 times more likely to have a heart attack. So it affects every part of your body. But I really like to focus on what we can do, to be quite honest with you, because many of our patients either have had a family history or have heard all these horror stories. I think a lot of our job as team members is to encourage them, say, you know, there are a lot of bad things that can go on, but there's a lot of good things. And when you look at diabetes, what other disease is encouraging you to eat healthy? What other disease is encouraging you to get out there and do some activity during the day? What other disease is really encouraging you to take care of yourself? So I actually like to focus on the positive aspects.
And Ms. Cox, has there been any resistance from the African-American community? Historically, we aren't typically types to go to medical facilities to get help until it's too late. And obviously diabetes is something that is very prevalent in our community. Has there been any kind of, I guess the term is resistance to treatment, management, even getting screened?
Some initially at the beginning, but now is because Parkland also has the COPC sites, the community centers in the community, and more patients or persons are kind of accustomed to seeing the center and coming in to have their, you know, blood sugars checked or blood pressure checked. So I think the resistance years ago to coming to see a doctor was higher, but now it seems our patients come and return, keep their appointments, and do try to follow through with most of the recommendations that are made. So I think it's less. Yes.
Okay, that's good. And as far as children, has there been any uptick or, you know, downfall of children getting diabetes more or less over the last, let's say, few years?
Over the last few years, some of our patients have pre-diabetes diagnosis, and that's the, you know, they're in that stage where they don't need medicine. If they can make some lifestyle changes, like follow a meal plan, exercise, lose maybe 10 or 15 pounds, their blood sugars or their diabetes test, the A1C would be in the normal range. But yes, there has been an increase, and it's not type 1, it's more or less those that are obese or those that don't do much exercise that end up with pre-diabetes.
I guess, and finally, in your opinion, what do you think is the most important thing the African-American community and African-American families should know about diabetes?
Is that it is a manageable disease. You can do a lot to delay being diagnosed or being having to take medication. Some of our patients can control their blood sugars, their A1C, with meal planning and exercise. And also there are other factors too that can affect their blood sugars, like stress, and of course not getting a good night's sleep. But those are just other lifestyle factors that could affect the blood sugars. I think, just having a pretty balanced life, if you could call it, eat well, do your exercise, be consistent with it, avoid foods or drinks too with added sugars or high fructose corn syrup, foods that would elevate your blood sugar levels.
I think on that note, Sharon, a lot of times if our patients do have a strong family history pattern, it can be really depressing. If mom or dad did have complications and die of diabetes, and now they're in your office really concerned and worried, but they're really trying hard, using that as an example for other members of the family. You're doing a great job with your sugars. You're really working hard on what you're eating. And sometimes, even in our classes, other people seeing this or hearing this are actually encouraged. So I think that's huge with our population too, with everyone. If we can see by example, if we can see that I can change my sugars, I can really work hard to improve them, and see that within family members, I think that really makes a difference.
And that is a part of it too. We need to share the information. If I have diabetes, it would be helpful to let my family members know, and they could start making changes that could help them prevent or delay diabetes.
And I think that's actually what the key is, Sharon. And that's something that, I think we all discuss with our patients. And it goes back to the kids. A lot of times what you'll hear is Sharon's telling them, this is a better way to balance your meals. This is a better way to think about portion size. And what you find out is, I don't have time, Sharon. I have to make this for me, and then I have to make that for my kids because my kids only eat this. And what I always tell them is, diabetes, yes, you have it, but it's really a family disease, because what Sharon teaches is healthy for everybody in the family. And I often ask them, do you really want your children to be sitting here with me in 20, 30 years, having this exact same conversation? Because when you were a kid, you didn't know how to eat healthier. And so now teach your kids now how to eat healthy and balance your meals and do that exercise. And when you go walking, Sharon, I always tell them, take your kids with you. Put them in charge of saying, come on, mom, get up off the couch. Let's go walking together. Make it a family sort of community thing where we're managing it together, so they don't have to be in my office, because that obesity epidemic in children, that's what's driving type 2 diabetes in children. And it's really hard for parents to look at their children and go, oh my gosh, you're doing the same things I am. You're checking your blood sugars, taking medicine. That's not what I wanted for you. So it's really that sense of community that you want to bring to that family to go, it's all of us in, all of us taking care of, and all of us staying healthy.
And I guess as my final kind of question, which I'll open up to anyone, is does the food industry have any responsibility in this? It seems like we've mentioned high fructose corn syrup, starchy foods, fried things, the oils we use, the sugars that are put into things. And it's almost impossible to escape that stuff if you just, especially if you live in certain neighborhoods where there aren't any options of fresh greens or veggies and stuff like that. Does the food, in your opinion, does the food industry have any responsibility into managing this diabetes crisis that we're having? A fifth of the population, apparently.
Absolutely. In my opinion, the food industry is a huge responsibility, and it's an ongoing battle, to be honest with you. I think, though, we are trying to reach out, different medical communities, including Parkland, having gardens, community gardens, having fruits and vegetables available at a low cost to individuals in those communities, Patrick, where there's one grocery store in a 25-mile radius, and value meal is cheaper than going out and buying fresh fruits and vegetables. So it is absolutely our responsibility, and teaching them, okay, buy a packet of seeds, you know, where you can grow something in a pot. Even if you don't have a yard, you can grow it in a pot. So I think it's education. I think it's fighting and fighting again and again and again, you know. Yes, look at our vending machines, you know, it's a struggle, yes, because what sells are those Cheetos and those chips, but what works are having, you know, healthier options available to them. So I think it's an ongoing battle, but I think we can always provide education. We can always provide resources. We can always say, if you're on this budget, what you can do.
And I think too, the food companies are there to make a profit. So we'll have aisles and aisles of bags of chips, sodas, and all the foods that have excess added sugars, the high fructose corn syrup, and also the saturated fat and high in sodium. But if we continue to try to prepare our patients when they do go grocery shopping, to make out your list, go get in kind of not just the necessities, but foods that you like to eat too, but avoid certain the different aisles in the stores, okay? And don't look at when you get to the front to check out, don't look on the side of you, because that's where the candies, the sodas are. The food companies will continue to produce all of this, but once you know better, hopefully you do better, you make better choices, and it's for you and your family.
Okay. Well, I'd like to thank you all for joining me. It's been a pleasure, and we do want to offer the audience that we will have all of these videos on our website and be promoting them throughout the week. This will be the last one, but you can go and rewatch these if you've missed them at our website at dallasweekly.com, and we'll be reposting them to all of our social media platforms. Again, I'd like to thank Parkland for providing us with a wonderful staff of people over the week that has helped us understand what's going on in the health communities of African Americans and Dallas at large, and would encourage you to go get checked, to go get screened. Please eat healthy and exercise, and hopefully we can beat all of these pandemics that we're in right now. Again, thank everyone for joining me. I appreciate your time, and we will see you again later.